Well, hello, everyone, and welcome to Ovarian Cancer Canada's Fall Symposium. I'm Kaylee Crawford, and I'm the Vice President of Programs and Policy. Now, before we get started, I'd like to begin our time together by acknowledging the Indigenous peoples of all the lands that we're on today. And while we're gathering virtually, let's take a moment to appreciate the importance of the lands we each call home and reaffirm our commitment to and our responsibility in improving relationships between nations, as well as our own understanding of Indigenous peoples and their cultures. We are so glad that you're joining us today. The Fall Symposium is really a time for our community to gather together and really see the impact of our shared efforts and generous support of this important cause. Now, over the next 2 days, you're going to hear from experts who are going to speak about topics such as research, genetics, cannabis and cancer. There will be workshops on self-care. And importantly, there will be opportunities for you to connect with our community of women and families across this country who've also been impacted by ovarian cancer and can relate firsthand to a lot of the experiences that you've had yourself. Of course, events like this are made possible by donors and generous sponsors. So a very big and special thank you to the companies who have sponsored the Fall Symposium, enabling us to deliver this really important initiative. Now, before we get started, I am going to cover a few housekeeping items just to make sure we can make the most of our time together. So first things first, we will be recording every session. So if you miss one, or if you just want to hear one again, you will be in luck. And on November 9th, you'll receive an email that will explain how you can access the recordings. So we just wanted to let you know that up front. Also, we are on the platform feed loop. You've likely noticed that. And on the right-hand side, you'll see that there's a chat box. Hopefully people have already, I think they're already writing there and introducing themselves there, saying hi to other people. This is really your space to add comments and thoughts that you might be having about a session you're in. And also it's an opportunity for you to ask questions. And so I just really want you to feel free to use that space. We have chat moderators and they will do their best to answer your questions if they can. But in the sessions where there's time for Q&A, the chat moderators are going to make sure that any questions that you write there are getting delivered to the presenters. So just rest assured that that is the right spot to be putting your questions. And again, just a great chance to talk with others who are watching along with you. And finally, I just wanted to mention on FeedLoop as well, you can also connect with other attendees one-on-one. Now, don't do what I'm about to tell you because it will kick you out of this session. But if you do want to chat privately with another attendee, you can, on the left-hand side, there's a networking button and you can just click on that. There's a list of everyone attending and you can click on their name and just click on Start Chat Now. And then you have that chance to speak one-on-one with them through the chat function. So lots of opportunities for you to connect with others. And we know we're not here in person, so we really do encourage you to use that chat box and to connect directly through the networking tab. So enough with the housekeeping, let's get started. I'm really pleased to be able to introduce Ovarian Cancer Canada's CEO, Tanya Vrionis, and also Erin Barrett, our new board chair. And they're joining us now to talk about the impact Ovarian Cancer Canada is making across this country. And they're going to provide their perspectives on what's coming next. So over to you, Tanya and Erin.
Thank you, Kaylee. Hello, everyone. Greetings from Surrey, BC. It's such an honor to be kicking off Ovarian Cancer Canada's Fall Symposium with you today. As you've heard, Erin Barrett is our new chair of the board, and she's been in the role for just a couple of weeks now, and I've been CEO since last August. So quite in line with the changing of the seasons, it's really a time of transition here at Ovarian Cancer Canada. Erin is likely a familiar face for many of you watching today, as she's been directly and deeply engaged with the community since her diagnosis in 2015.
Thank you, Tanya. It's so great to be joining you today. Since my diagnosis, I have been an active advocate, from sharing my story on social and with different parts of the media, to joining the board, to fundraising for the Walk of Hope, like many of you, and recently to joining the Patient Partners Program as part of Ovarian Cancer Canada's OVCAN Research Initiative. Now I'm very excited to be taking my new role on as board chair, What an honor, particularly at such a crucial point in the organization's history. Ovarian Cancer Canada has always been a catalyst for change, leading progress against this disease for nearly a quarter of a century. It's been impressive to see the organization evolve from its grassroots beginnings to a veritable force to be reckoned with, having successfully secured a historic research investment from the federal government following years of intense advocacy, and then multiplying the success with further contributions from the provinces of Saskatchewan and Nova Scotia, as well as the private sector.
Tremendous accomplishments indeed. So I've spent much of my career in the nonprofit sector working on a variety of causes ranging from healthcare to education. And in my experience, I've seen that securing government funding for research can be extremely challenging. And the success of Ovarian Cancer Canada, that really struck me as I was learning about this incredible organization. Erin, in your opinion, what made Ovarian Cancer Canada's advocacy push so successful? When you think about all of the charities looking for funding, why do you think the government said yes to this one in particular?
That's a great question. And really the answer is that, in a sense, it was the perfect storm. So government at the time had a mandate to address women's health issues. And the organization had been catapulted onto the public radar with our award-winning awareness campaign. I'm sure you all remember the Lady Ball campaign. And of course, ovarian cancer has been overlooked and underfunded for decades. Still, with all of that, it took many community champions to inspire the support of key decision makers. Thousands upon thousands of Canadians made their voices heard by writing to their elected representatives. Then, at numerous meetings with ministers and MPs, scientists, women, and families of those affected directly by this disease shared their personal stories and insights. In addition to all of this, I really believe the key was that we had a solid plan, thanks to all of the ovarian cancer researchers who convened behind the scenes to figure out what exactly was needed to change outcomes fast. Importantly, these researchers are working hard for women and families affected by this disease. And it's because of Ovarian Cancer Canada's focus on building scientific capacity for research, so that as soon as the funding became available, we hit the ground running with mechanisms and infrastructure in place to make the very most of every single dollar.
And have we ever made the very most of every single dollar? Dr. Vanderheiden, as well as other leading scientists, will be here tomorrow to share some of the exciting progress underway through Ovarian Cancer Canada's OVCAN initiative. But I'll tell you what I've seen is that the capacity that's been put into place over the years by Ovarian Cancer Canada and this recent OVCAN investment have together really put some long overdue hope on the horizon. The sum of this work made it so that even during the pandemic, when many charities were forced to claw back research funding due to decreased fundraising revenues across the country in so many areas, Ovarian Cancer Canada was really able to keep the lab lights on at leading institutions across the country. And we are doing everything possible to fuel and bolster that momentum so that science can go further faster. In addition to bringing forward research, Ovarian Cancer Canada has really continued to build and enrich programming. We adapted so quickly to the challenge of COVID, keeping the health and safety of the community top of mind, even now as we discover this new normal, whatever that may be. And thanks to the generosity of our donors and support and sponsors, we are delivering the best information online direct from experts. Over the pandemic, the team has brought you symposia like the one today, twice annually, a monthly speaker series that addresses topics like living with resilience in times of uncertainty, TLT gatherings, which invite women with ovarian cancer to see the faces and hear the voices of others across the country, but in a safe and supportive virtual space, and so much more.
It's all been so wonderful. Well, we've been spending so much time on our computers and devices. For me, it's been refreshing to see Ovarian Cancer Canada rising above the rest with credible insights and expert knowledge on issues women like me actually care about. It's also clear that care is being taken to empower authentic connections between my fellow Teal sisters who are all affected by ovarian cancer, because there's no support quite like that of someone who has been there and can relate firsthand. Speaking of my own experiences with Ove Dialogue, our online community, the women on there have been important lifelines for me on some really challenging days. I can only imagine what it must have been like for the thousands of women who were diagnosed with ovarian cancer during COVID. In and of itself, a diagnosis can be extremely isolating. And because people were isolated as it was with COVID, it became even more difficult to get support. Ovarian Cancer Canada, I'm proud to say, filled this crucial gap at a time when it felt like everyone so near and dear was lost. Programs that continue to allow us to engage with one another really helped break through in the best possible way.
The pandemic really did help people find Ovarian Cancer Canada, and as a silver lining, I think brought the community together in so many ways. And we've been hearing from women and families far and wide who live in remote towns and rural communities, long distances from city centers, who had never met anyone else affected by this disease. But because all of our programming went virtual, they tuned in and for the first time saw the vibrant community that's standing with and beside them. Finding support, as we know, has tremendous implications on a person's quality of life. And that's why we're so proud at Ovarian Cancer Canada to be bringing forward these opportunities for Teal sisters to connect and get to know one another in a safe space, even as we continue to champion the health and well-being of women living with this disease and those at risk for it while advancing vital research.
When we think about research, many of us, myself included, picture scientists at a lab hard at work. Indeed, Ovarian Cancer Canada has made this possible by, first of all, attracting the top tier talent and ensuring the availability of raw materials and the tools that researchers need to test treatments and initiate clinical trials. I can draw a direct line from all of those moving parts to Ovarian Cancer Canada, which works together with strategic partners and leading experts in the field to vet proposals based on best evidence and emerging knowledge. Something really unique to Ovarian Cancer Canada is that women like me also feed into this process. I recently signed up as part of Ovarian Cancer Canada's Patient Partners in Research program. So this gives me and many other women like me the opportunity to share my true lived experience of ovarian cancer with the researchers to help inform decisions about which projects will have the greatest impact on our lives in the shortest span of time. Because as we all know, there isn't time to wait. Not when it comes to this disease.
You are absolutely right, Erin. Time is of the essence. This also applies to our advocacy. So thinking, as we just discussed, the funding that was secured for OVCAN, it's limited, and we're currently in year 3 of 5. So the time is now, right now, to rally for further funding. We know too well that a massive groundswell of support is going to be needed to secure research investments for the next 5 years and beyond. So together, this community has come so far and very quickly when you really look at it. So stopping or even slowing, even just a little bit, that's not an option. We're closer than ever to improved treatment options. There's a whole swath of clinical trials that have just started, and we need to keep pressing for change. Currently, the team is working really hard on this and at the same time gathering evidence on the landscape of ovarian cancer care across Canada. We're taking a multi-pronged approach to ensure that, number one, research continues to blaze trails, and two, that all women in Canada with ovarian cancer have access to the best care, regardless of where they live.
Absolutely, because there's no question in my mind that we women deserve this. With decades of being overlooked and underfunded, ovarian cancer is a health issue that requires continued prioritization. There is a lot of work to be done, and it is a complicated set of diseases, and there is not simply a one-size-fits-all solution. That's another thing that I appreciate about my role as a patient partner and as chair. You see, I was diagnosed with a more rare form of ovarian cancer, and I am committed to raising the teal flag for all types of this disease, not just the most common, all of them. Because I am convinced that one of the reasons I had ovarian cancer is so that I can be here now, today, contributing to this vital cause and taking an active role in improving the journey for others.
When you talk about raising the flag for all types of this disease, it really leads me to the next important thing on my mind, and that's that Ovarian Cancer Canada is here for all people with this disease. And a recent and a highly relevant experience was leading up to the National Day for Truth and Reconciliation just a few weeks ago. And ultimately, I came away from that learning that we really have a lot to learn. And I acknowledge that with a full heart. When I think about this in the context of our work, ovarian cancer has so many faces, and we are committed to learning more about all lived experiences of this disease. It's the only way that we'll truly be able to make a difference for all affected. At Ovarian Cancer Canada, we're opening up conversation by meeting with thought leaders to discuss diversity and inclusion with a view to how can we do better? Because our teal flag, as you so elegantly put it, Erin, it's meant for everyone. And together we will change the course of this disease for good, so that all people affected by ovarian cancer and others at risk for it live fuller, better, and longer.
That's so deeply true. The work of Ovarian Cancer Canada, it's made possible by people just like me and you. And every gift, even big or small, no matter how much, counts. I want you to know that the team makes sure that every single dollar is maximized to support our work in improving care and enabling critical research and prevention to stop this disease before it starts. I have seen firsthand the impact the donations make, and as you've heard, it's being felt across the country. Speaking as a donor myself, I'm immensely proud to see such meaningful results. Because of my involvement with Ovarian Cancer Canada, I'm part of the change that I want to see, and I'm seeing that change take hold for the better and for generations to come. If ever there was a time to give to Ovarian Cancer Canada, it's now. Your support will help plan ahead as we gear up to advocate. It will change the lives of women with ovarian cancer, as well as of others who have the power to prevent this disease. We can and are making a tremendous difference.
Erin, thank you so much for joining me today. I'm sure we could talk for hours about all of this, and I'm so grateful. Thank you so much for your efforts as a valued member of the board, and now as chair. A big thank you to everyone who opens their hearts and wallets in support of Ovarian Cancer Canada. It's because of you that hope lives here, and your support continues to go a very long way. Additionally, much of our funding each year is raised by participants in the Ovarian Cancer Canada Walk of Hope. Thank you to everyone who participated in this year's event, and to everyone who gave their hard-earned dollars in support of this critical work. Here with some highlights from Walk Day is Jessie Weisblatt, our Community Engagement and Events Associate, and the friendly voice assisting with any walk-related questions.
Thank you, Tanya, and hello to everyone tuning in today. As many of you know, the Ovarian Cancer Canada Walk of Hope is the most powerful event in the country dedicated to affecting change for women and families living with ovarian cancer. In keeping with our commitment to prioritize the health and safety of the community that we work with and for, this year's event was entirely virtual. There were no official walk locations, and so across Canada, thousands donned their teal and they tied up their sneakers to walk a route of their own choosing, all while raising funds to help save women's lives. This year, participants leaned in and dug deep to make the walk their own. Even despite our physical distance, the hope we carried in our hearts as we walked towards our shared goal under the same sky brought us closer as a community, and at the same time, enabling tremendous strides in improving care and outcomes. Thank you so much to everyone who participated on Walk Day and to everyone who donated. Because of your generosity of spirit and your contributions, the walk has raised over $1.21 million and counting in support of Ovarian Cancer Canada's mission. We hope you will join us again next year on September 11, 2022. And as many of us continue to reach for a new normal, events like the walk are evolving, but the community is pressing on. Back over to Tanya to shine a light on the incredible passion and achievements of some of our community champions.
Good to see you again. We just wanted to take a few moments to reflect on some of the community champions in our midst. You are part of a community and you are standing shoulder to shoulder with women and families dedicated to improving outcomes. Let's take a look at what you have accomplished with and for the community. Here are some of this year's highlights and a few of the ways the community champions are helping to advance progress against this disease. You show up for the cause year-round. As we continue to reach for new normal, keeping the safety of our community a top priority, people across Canada are hosting their own fundraising events in support of Ovarian Cancer Canada and inspiring others. Talk about going the extra mile. Events of all shapes and sizes, such as rides, runs, auctions, and fundraisers, they rally support and help ensure progress against this disease. May 8th is World Ovarian Cancer Day, a global day of recognition, a day to put the spotlight on this important women's health issue. You continue to rise to the challenge and raise the teal flag. You raise your voices, share your stories on social media, touching the hearts of your closest friends and complete strangers. That's the power of your words. Donors and community members, many who are here today, open their hearts and their wallets to show their commitment and take a stand because women deserve better. On World Ovarian Cancer Day and every day, we are more powerful together. Funds raised ensure that advocacy for the best care continues, enables vital research that reaches women across Canada and beyond, and ensures women benefit from year-round programming and important lifelines like the OV Dialogue online community. OV Dialogue is a secure discussion board for Teal sisters living with ovarian cancer to share their experiences, give, and get advice. Teal sisters are moderating this safe place for women to connect, offering support, and hosting live chat sessions. While everyone's experience with this disease is unique, no woman has to face this disease alone. And no woman walks alone, as you've just seen. In addition to walking and raising funds on Walk Day, the community recognized the recipients of the Peggy Truscott Award of Hope, which celebrates people who support the mission of Ovarian Cancer Canada. This year's recipients are shining examples of how to affect change and help improve outcomes for women across Canada. Congratulations to Jennifer Smith of Victoria, BC, Colleen Tuktuk of Saskatoon, Saskatchewan, Donna Pepin of Toronto, Ontario, Lawrence Dompierre Major of Montreal, Quebec, the Lady Ball Halifax committee members, Andrea Hatfield-Beaton, Kathy Perry, Deb Lusby, Tanya Blunden, Jody Sampson, and Mary Jane Wells. Andrea will be taking the stage later this evening to share some inspiration. Of course, volunteering takes every shape and form these days. Thank you to the volunteers across the country who are dedicating their time and efforts to this vital cause, who have really made this cause their passion. And speaking of passion, Virginia Green was a leading businesswoman in British Columbia and fierce advocate. The award named in her honor recognizes outstanding contributions that have led to the advancement of knowledge and research pertaining to ovarian cancer. This year's Virginia Green Award was presented to Eileen Beadle. Back when there were competing national organizations dedicated to addressing ovarian cancer, Eileen helped blaze a trail to bring about the first ever amalgamation of two national charities in Canada, championing one voice for all women with ovarian cancer and establishing the beacon of hope that you know today as Ovarian Cancer Canada. Beyond this, Eileen's volunteering ranges from long-standing involvement on the board, deep community engagement, and a series of fundraisers in support of our mission. Like Eileen, you have helped bring events to life across the country. While gala events have been put on hold, for her, an online auction in support of Ovarian Cancer Canada emerged for a sparkling debut. Generously donated items were all the rage on the auction block, and every dollar spent was put to work immediately to help improve care, advance research, and enable prevention. In addition to the impact being made here at home, Ovarian Cancer Canada is part of an international worldwide movement to see that this disease continues to be prioritized globally. This past year's past CEO, Elizabeth Baugh, received an international award for her leadership on the world stage and here at home. As well, the Every Woman Study Canadian edition, which documents the lived experience of ovarian cancer in Canada, received acclaim from the World Ovarian Cancer Coalition. Ovarian Cancer Canada is a beacon of hope for women and families across the country affected by this disease. You make this work possible. The future brims with promise, and we continue to invite your involvement. Thank you for your ongoing support in every way, shape, and form. Now, back over to Kaylee, who is joined by a few new faces from our community.
Thank you, Tanya. I now want to take a few minutes to introduce you to a couple of people who bring a fresh perspective to the hope made possible by Ovarian Cancer Canada through our programs and the OVCAN initiative. Sylvie Ald was diagnosed in 2008. Sylvie is deeply committed to research and jumped at the opportunity to get involved with the OVCAN as a patient partner. And the role of patient partner is so incredibly important because within this role, Sylvie shares her lived experience with ovarian cancer and her deep insights to inform and enrich the decision-making process. And she joins us today alongside Sarah Nersessian, who is a Vanier Scholar and a research trainee dedicated to the study of ovarian cancer. So welcome to both of you. Thank you so much for being here. Sylvie, I'm going to start with you. You were diagnosed more than a decade ago, and that alone, I think, is inspiring for so many people tuning in today. And I know this is a big and fairly impossible question, but I'm hoping you can talk a bit about how having ovarian cancer has affected your life.
Well, thank you, Kelly. Bonsoir tout le monde. Good evening, everyone. Ovarian cancer is like winning at the lottery. I know it's not cool. It's not a cool lottery, but like lottery, it would not change the world, but it certainly changes your own personal world. Like all other women who once received or will receive this unfortunate diagnosis, I thought someone made a mistake. It was a wrong file, wrong person, incompetency, name it. It was clear I did not have cancer. It was unreal. I was way too young and healthy, and beside my mom just passed. So not me, but guess what? We have to compose with the diagnosis, and I had to accept and act accordingly. And at most, we have to redefine ourselves. So while we are proud of our work and our overall life and love and family, and suddenly we become what? A patient, a sick person, a person under chemo, a hairless person, a eyebrows-less person, and eyelashes-less person, a steroid moon face person, which walk from a chair to a couch, but who finds enough energy to run out of the grocery stores when the greasy chicken they're cooking gives you nausea in a second. So who am I? Where did I go wrong? Why me? Did I miss something? Finally, it takes a while, but we understand that we just picked the wrong lottery ticket, wrong number, the winning number. From there on, what if I die? That would be sad because there's so many things I haven't done and I should have done or I want to do. What are my priorities? Do I have the right ones? I don't know. You have to redefine yourself. Really, it changes changes is part of life, and it's normal. Everything is part of the perpetual movement. Um, we cannot and should not take anything for granted, and life is too short. We cannot wait to realize and accomplish our bucket list. A few dreams, by the way, tomorrow may not even exist for us. We are left with now and here, and we cannot do anything for the past. So, hey, now and here is the best way to digest the disease and not to miss a minute. Then I realized that we are not at all equal in this journey. Still too many women leave too early and too rapidly. And I was just lucky even with this bad lottery ticket. Many women could have been speaking today better, clearer, louder, persuasively, but ovarian cancer did not leave them a chance. My doctor, a Wonder Woman, told me one day that the silence of those women is very loud and says a lot about ovarian cancer. They are not here to speak up, to bring their knowledge, to ask for more research, for more money into ovarian cancer. Therefore, the ones surviving have to take the floor and give voices to all those mothers, grandmothers, daughters, wives, sisters, cousins, friends who left too early. Some of us survive and we then pass turn and life goes on. Often there are too much sadness associated with the disease, but ovarian cancer still exists. It's a black cloud over our head and continues to kill women we love. One day, a good friend of mine, a very dedicated patient partner and advocate in research, the best friend of Michel Saint-Pierre, my friend too, who had the same chemo and same clinical trial as I did, and she also didn't want to die. And an emeritus scientist at the CR CHUM in Montreal hooked and fished me. They had me meet the patient partners in research, patient advocates who did and are still doing remarkable work. I thought, and me, what am I doing? What am I doing for those women, the one with ovarian cancer? And with the help of OCC, I just jumped into the boat because it's never too late to help save a life. So that's it for me.
Wow, well, thank you for sharing that, Sylvie. That's a lot. That's a big question. So thank you for that really amazing answer. I have another question for you though. Can you tell me a bit about what brings you hope and what hope means for you? How do you have hope within that context of this diagnosis?
OCC did and continues to through supports and have dialogue and UFCAN and all those parts of and hands within the cancer to militate for us, and that in itself is hope. They're creating hope by many means, and with the help of dedicated patient advocates sharing their stories, they convince the politician, the informed and sensibilized on ovarian cancer, and mostly on the very urgent need to give money and fund research as the regular basis treatment for this cancer is pretty much the same for the past 30 years. So money was desperately needed for research, and we need to favorize progress, and research is hope. So for me, one equal the others. We need this killer to be denunciated and condemned. We want that woman being diagnosed live fully, longer, and in good shape. Just to say how inspiring and hopeful it is to meet young scientists, Sarah, who get interest into ovarian cancer. It's wonderful, it's pure hope. We immediately need to hook them. The cancer cells they see through the lenses of their microscope need to be associated to me, to you, to anyone touched by ovarian cancer. A cell, a look, a woman who lives on the hope of a new treatment, of a discovery that will prolong her life, will ameliorate her life, and who knows, will cure her. Needless to say, patients count on researchers. I have the chance to know Dr. Diane Provencher and Dr. Anne-Marie Masson, not to name them, including team clinical nurses, all of whom put in place the winning conditions to the best possible discoveries. But that is possible with OCC. I have been moved and happily surprised to see the succession of young, dedicated scientists, mostly women, and those smart ass, I didn't want to say that. I wanted to say genius will make incredible discoveries for all women with ovarian cancer, given they are funded. To you all scientists, thank you, and researchers, thank you so much to turn your interest toward ovarian cancer, and thank you in advance for all the pain and efforts that you will put to try to save your sisters. Thanks in the name of all of ours, the Teal sisters. Research is hope. Thank you.
Oh, thank you so much, Sylvie. I want to turn to you, Sarah. I mean, what is it like to hear about what research like yours means to people like Sylvie?
Yeah, thank you for having me speak, and thank you, Sylvie, for sharing. I think every time I hear a story about a woman who's gone through ovarian cancer, I just honestly get more emotional about the cause. Personally, I've had family members who have suffered from women's cancers, and specifically some of the unwanted side effects. And that is really what initially got me interested in doing cancer research, but that was years ago. And so anyone who knows a researcher or a student knows that day to day it can get a little bit demotivating, especially with experiments that, fail day after day. It can be really exhausting and difficult. And the academic atmosphere right now is so competitive, which is why we need funding and we need these donations to be able to do this research. So having almost like an update or a refresher or a reminder about why my research is important, why I go in every day into the lab and I try again after experimental failures or hardships and challenges that inevitably come with lab work. It's so important. It's a really important perspective that can get lost sometimes. And having somebody speak to the impact that research has made in their clinical experience, whether it's through a clinical trial or, connection with researchers that have inspired them and brought them hope, brings me hope as well, and encourages me to, make sure that I am reaching my full potential every day that I go into lab, because I'm not only doing this for a few individuals. The research here is for women or individuals with ovaries that are suffering from a disease that has not had attention, has not had the dedication and the funding that it deserves. And I truly believe that this new wave of researchers in Canada, specifically the young women that I get to work with, are a collaborative group. We support each other. Sylvia was talking about Dr. Anne-Marie Masson. I spent a week there doing research and training and learning. Again, a lot of this is possible because of funding that is able to send me places and train me, and I'm able to bring that back to my lab. I think the most important thing also about hearing these stories and hearing about the hope that I bring is that I can bring it back to just sitting on a microscope for the 80th hour. Trying to look through and analyzing my tissues. I work on large databases that include over 1,000 women with ovarian cancer. And sometimes, when you're on the 70th hour looking through a microscope and analyzing things, it is really important to remember that what I'm looking at is not just a tissue. It's a woman who donated this tissue to research. It's one more woman that my research has the potential to impact.
Well, thank you so much for doing what you do, Sarah. Sylvie, thank you for sharing your insights with us and talking about the impact of the disease and the impact on hope. We are going to hear more from these two in the weeks to come. You'll be hearing more about their stories, but thank you so much for joining us here today.